Are you thinking of starting Invisalign? Do you want to know what happens at each individual appointment? Let me walk you through the Invisalign journey and show you some potential alternatives to Invisalign that I think you may like. First things first, if you want to get Invisalign or any other clear aligners, you need to come in for your consultation. That's when we're going to take a panoramic x-ray and a cephalometric x-ray, and you can talk to the doctor or me about any of your main concerns. Then within 30 to 60 minutes, you're going to know your treatment options, likely outcome, and finances. Now keep in mind your consultation with the orthodontist is probably only going to take 10-15 minutes, but then they're going to talk to you about finances, insurances, the whole process. That's why we allow up to 30 minutes, maybe even up to 60 minutes for a consultation. If you have any orthodontic insurance, they're going to utilize that here. And just as a reminder, if you use orthodontic insurance for braces or Invisalign, it makes no difference. And here's a little pro tip. If you want to get started right away, make sure to get all your dental work, including dental cleanings, done before that appointment. But do not get any implants or bridges done because that should be done after orthodontic treatment. So if you saw the finances, you saw the treatment plan, you're excited to get started, they're going to take an impression and or scan on that very same appointment. And that's it. That's appointment number 1. That is the consultation. Appointment number 2 is roughly 4 to 6 weeks later, and that's when you get those Invisalign trays in. So you're going to come into the office, you're going to put the attachments on, and that's when we're going to walk you through how Invisalign works and how long you have to wear your Invisalign trays. Another pro tip, if you don't want as many attachments on your teeth that you see with some Invisalign patients, you can try other companies such as CandidPro, and I'm sure there are others that use less attachments than Invisalign. So at this second appointment, you're going to get your trays, you're going to get your attachments, and the orthodontist or dentist is going to explain to you how many trays you have and how to wear your trays. Almost every dentist and orthodontist is the same. They're going to tell you to wear these trays 22 hours a day. You can take them off to eat, brush, and floss. Other than that, they're going to be in your mouth. At that appointment, they're going to give you a bunch of trays, and every orthodontist is different. For me, I give you probably anywhere between 8 to 14 trays. So you're going to have definitely a few months worth of trays before you have to come back in. Now, when you come back on your next appointment, that'd be your 3rd appointment, maybe your 4th appointment as well. All we're going to do is we're going to check the fit of those trays, make sure everything's going well. Maybe we're going to give you some rubber bands. Maybe we're going to do some slimming or IPR in between your teeth. Whatever we're going to do, we're going to make sure that the fit and the treatment plan is progressing as planned. So now after you've gone through all your trays, you've worn them 22 hours a day, you're changing them out every week or two. Once you've gone through that full first set, you're going to come back in and see how you like the results. If you are happy with how everything looks and the orthodontist is happy with how everything looks, you're done. What we would do is we take off all your attachments, we take an impression for retainers, and ideally that day or the next day, you'd get your retainers. Now for me, you wear retainers 24/7 for the first 3 months, and then you move to nighttime only. And of course, just like Invisalign trays, you're taking off your retainers to eat, brush, and floss your teeth. But if you go through that whole process, you can go through that first set of trays and you're not that happy, or they're pretty happy, but not quite perfectly happy, what we do is we take another impression or we take another scan and we go and get some more trays. So it'd be the same process. You take a scan or you take the impression, we wait 4 to 6 weeks, and then we get those new trays back in. That process is called a refinement, and typically in 95% of the offices, that is just included in the price that you've already paid. And 95% of the time after that second round of trays, you are happy. So you come back in, we take off the attachments, and we give you some retainers. So here's a few tips about Invisalign or any clear aligners. Know that you're gonna have to wear them at least 22 hours a day. You're gonna take them off to eat, brush, and floss. You'll likely have some attachments unless the office is using some other company like CandidPro or similar. Most offices like us and many others are going to offer you payment plans, and they're going to try to maximize your orthodontic insurance. Orthodontic insurance is typically a lifetime max and does not renew yearly, so make sure you keep that same insurance for the total duration of your treatment. If you don't keep that insurance for the total duration of your treatment, it likely will not pay out the full amount that we predicted. Now lastly, you want to buy something called Chewies. They just allow you to seat these trays better in your teeth so that you're going to have a better outcome. So let's review what to expect at each appointment when you have clear aligners. Number 1, you're going to go through the consult where we're going to go through the treatment plan and all the finances. Number 2, about 4 to 6 weeks later, you're going to get the clear Invisalign trays, and we're going to deliver those attachments as well. After that, you're going to go a few months likely before we see you again to make sure that the treatment is processing just like we planned. And the next appointment after that, if everything looks good, we're going to take off the attachments and give you some retainers. And there you have it. That is how easy Invisalign is, or any clear aligner process. Once again, Dr. Nate here at Thrive Dental Orthodontics. And if you have any value in this video, please give it a like and a subscribe. And if you have any questions or comments, leave them below. And I'll see you guys in the next video.